I've been in the NHS for 25 years now. To me, this is revolutionary.
Morale is up and it really does work.
And they're so proud. It's kind of tear in the eye kind of moment. You just cannot buy that sort of enthusiasm.
I think it's a really outstanding but very simple solution to some very significant issues.
I think it would be a sin for us to go back to the way that we worked before.
South Tyneside as a borough does have its significant health challenges. We've got a strong industrial heritage which brings with it a legacy of heavy industrial diseases.
We have higher than the UK average of cardiovascular deaths, cancers, obesity.
We have high emergency admissions to hospitals, so we have lots of people that go into hospital unnecessarily.
Our life expectancy in the borough is something like 10 years worse than the national average.
If we do nothing over the next 10 years, we're going to need 130 extra hospital beds at a cost of around about £18 million.
We'll need to almost build another hospital. If we don't change the pattern of service delivery and how we care for people in the borough, we will be in real trouble.
The patient today is a gentleman who we've been visiting every day for the last 2.5 weeks. He's had a fractured neck of femur in the hospital. The gentleman also has a multitude of chronic diseases, including chronic obstructive airways disease and anemia. This patient's very typical of the patients that we see on our round on a daily basis. Prior to our integrated system, this gentleman had a lot of fragmented care, different disciplines attending him each week, resulting in numerous different calls of community matrons, occupational therapists, physiotherapists, district nurses.
In a day, one patient could have anywhere between 4 to 5 different health professionals coming in, and I think for the patient, being lost in the system would be quite easy.
We would often be unaware of people who are involved in patients' care, so potentially we would visit and unbeknownst to us they have a community matron and a social worker that we were unaware of, which then leads to multiple conversations with different people about the same individual.
For me, as a district nurse, it was very difficult, it was challenging, it was fragmented, not being able to refer direct to other disciplines, really sometimes not knowing who the different disciplines were involved in this gentleman's case. You would take days, often weeks, for referrals to be passed on.
This doesn't feel like a very clever way of providing care to patients or indeed spending public money.
We had a defined vision together, which was a seamless, community-based service for residents in South Tyneside, and it was as simple as that.
And we really needed a way of doing that helped people to think out of the box, encouraged creativity and innovation, and broke down the barriers that existed between organisations and between professionals as well.
One of the first things that NHS IQ got us all to do as a leadership team was to stand up in front of the entire health and social care community. So the Big Five, as we became known, that's the chief executives of the CCG, the Acute Trust, the Council and the Mental Health Trust and Community and Voluntary Sector, all stood up in front of a group of care providers. And one of the things we said was, there is a problem here. We think you've got the answer to it, not us.
I think it gave staff, certainly across all organisations, a really good understanding that the chief executives absolutely had bought into what integration meant and into the partnership and the way of working, and had full understanding of how the staff wanted to work.
It was a bottom-up approach, so we actually led the change, which then gave us the ownership, the power, and I know I keep using the word, it gave us the permissions to do what we knew was right.
Taking part in the NHS IQ events was liberating. We were able to put our points across. I felt as if our ideas and thoughts of future practices were valued.
I imagine all of us at some point during those sessions were probably outside of our comfort zones. There was quite significant thinking to be done around new radical ways of service delivery that were very different to the traditional methods.
NHS IQ came in and gave that level of independence, but also the assurity, because they're such an experienced brand, if you like, that gave people those permissions and set the scene for people, that they understood what the vision was and what the outcomes were going to be.
By November, I think we'd had 6 NHS IQ events, and we knew we were going to do something, and if we were going to do it, we had to do it there, then and now, because there was never, ever going to be a good time. The IT systems we knew weren't going to be in place, we knew the rooms weren't going to be, but there will always be a problem. So I think as a group we just went, let's get on with it, and we give them the date.
On a weekly basis, the team has a multidisciplinary team meeting. So we would have a community matron, a district nurse, and the local authority staff, which is social workers and occupational therapists. The meeting is solely so that any new patients or complex patients can be discussed, and the most relevant care coordinator can be appointed.
First gentleman to discuss is John. Maria, I think this is a patient of yourself.
He has a diagnosis of lung cancer and query liver metastases. He's been seen by the district nurse and full assessments have been completed.
A care coordinator is the person who's involved mostly in the care of the individual. So when we were doing the development work, we called it almost the possession rule. So the person who will see that person the most will act as their care coordinator.
Michelle, just to discuss his care support needs. His wife is actually starting to struggle with him because he is becoming quite poorly. What would you think about doing a joint visit?
Yeah, see if there's any services we can offer him and his wife.
That care coordinator will take responsibility for care planning and communicating with the other professionals in the team who will probably still be involved in the care of that patient, but perhaps not as much.
He has started to become more breathless and he is finding the stairs quite a struggle at the moment. So I think it would be beneficial, for your input.
Right, so you would benefit from an occupational therapy assessment.
That would be great.
Yeah, well, after the meeting we can have a chat and I'll arrange to do a joint visit with you and Michelle. That's all right.
Brilliant.
She does have a hyponatremia, and so I'm aware that she's on vitamin B12 for that, which she receives 3 monthly.
If you're going in 3 monthly, then would you mind taking over and giving her vitamin B12 injection?
Yes, it'll coincide with my monthly visits, and so I'll ensure that's done and do our pressure ulcer prevention as well.
Essentially what we do is we discuss all the patients who are having complex needs, who are quite high demand at the moment, people who are difficult to manage, so that we can try and work out a way to resolve any issues or problems. Pain had been an issue, and his wife was under the impression that she was giving him too much Oromorph, so has been withholding that despite him still having pain. Attending the workshops, I'd actually anticipated that my workload temporarily would actually go up by the involvement in the delivery team. However, by having these meetings, I actually found that my activity actually lessened, and I perhaps passed a lot of my problems to the team who were better able to deliver.
Patient has carers now who are coming in, 2 carers 4 times a day. That's really helping the family, the carer situation, where they feel more supported. Good morning.
Morning.
Good morning, Margaret. Good morning, Richard.
Good morning.
How are you today?
Oh, jamming.
Oh, lovely. I'm going to get my apron on, and then
and we'll sort out that injection. It's very satisfying to see improvements before your eyes, and also in a very short space of time. To know that you have contributed to that your opinion is valued.
We get on so well, we talk to each other now. The patient is at the centre of everything that we do. And between health and social, we've come such a long way. I've been in the NHS for 25 years now. To me, this is revolutionary.
Richard, that's perfect. The blood pressure of an athlete. Oh, that's lovely, isn't it?
I listened to the community matron and the district nurse and the social worker stand up and talk about how they've really changed the way they work on a day-to-day basis, and they're so proud. It's kind of tear in the eye kind of moment. You just cannot buy that sort of enthusiasm.
Is it all right if we do your injection now?
Aye.
We tested the prototype and that's deemed absolutely to have been a success, and we've rolled the model out to cover 5 more GP practices in the locality. We'll be continuing to roll the model out across the borough.
The benefits for patients is continuity. All patients love continuity. That is the most important thing, that they speak to somebody who knows about them.
I've probably spent half of my career in nursing and half in local authority. So I think it's a really outstanding but very simple solution to some very significant issues.
I'll be seeing him initially weekly because he's quite unwell, so I'll be taking over that pressure area care from the district nurses.
We're looking at how we engage other services now in how they interface and work with the integrated team. So we're talking to our mental health services provider, for example, housing services. We've also been working closely with our third sector partners across South Tyneside.
The feedback from patients and the staff, morale is up, and it really does work.
And I've led a lot of teams working in different ways, and I can honestly say from this way of working it's the most positive, and I think it's a really happy team where I think it would be a sin for us to go back to the way that we worked before, because we can see the benefits for the patients and for the staff.